Most people don't actually know what causes these kidney problems, and that is something we really need to talk about. Kidney disease is not caused by one single thing. There are different diseases, conditions, and habits that can gradually affect the kidneys. Diabetes. To begin with, when a person has diabetes, high blood sugar levels can damage blood vessels, and their blood sugar remains high for a long period of time. That excess glucose can gradually damage the tiny blood vessels inside the kidneys. Remember, the kidneys are constantly filtering your blood. So when these delicate filtering structures are repeatedly exposed to high blood glucose, they can become damaged. Gradually, the kidneys may begin to lose their ability to filter properly. This can lead to chronic kidney disease and, when the damage becomes severe, kidney failure. Moving on to another major cause, we have high blood pressure. High blood pressure doesn't only affect the heart and the brain, it can also silently damage the kidneys. The kidneys contain numerous tiny blood vessels, and when blood pressure remains elevated for years, these vessels can become damaged. As this damage progresses, the kidney's filtering ability can decrease. Interestingly, kidney disease can also cause blood pressure to rise, creating a dangerous cycle where one condition can worsen the other. Now, let's talk about kidney stones. This is something many people don't pay enough attention to. Kidney stones are hard deposits that form when certain substances in the urine become highly concentrated and crystallize. For instance, imagine a diet high in salt and other stone-forming substances, but consistently takes too little fluid. Their urine can become more concentrated, and under the right conditions, substances such as calcium, oxalate, or uric acid can crystallize and form stones. However, it is important to understand that simply eating a particular food and drinking little water does not automatically mean someone would develop kidney stones. Genetics, diet, fluid intake, obesity, certain medical conditions, and other factors can contribute. When a stone becomes large enough to obstruct the urinary tract, urine may not flow properly. That obstruction can cause severe pain and, if prolonged, can impair kidney function. Beyond that, kidney infections are another important cause of kidney problems. A urinary tract infection can sometimes travel upward from the bladder, through the ureters, and reach the kidney. When this happens, it can cause pyelonephritis, which is an infection of the kidney. A person may develop fever, chills, pain around the side or back, painful urination, nausea or vomiting. This is why symptoms of a serious urinary infection should not be casually ignored. Another issue we must not overlook is medication and self-medication. Many people take medications without thinking about how those medications may affect their kidneys. For example, ibuprofen, diclofenac, and naproxen belong to a group of medicines called NSAIDs, non-steroidal anti-inflammatory drugs. These medicines can affect blood flow to the kidneys and increase the risk of kidney injury in susceptible people, particularly when they are used excessively or for prolonged periods, or when someone is dehydrated or already has kidney disease. So the message is not that every painkiller will automatically destroy your kidneys. The real concern is abuse, inappropriate use, and taking medications without considering your individual health condition. And equally important is dehydration. Your kidneys need adequate blood flow to function properly. When you become severely dehydrated, perhaps because of prolonged vomiting, diarrhea, excessive sweating, fever, or significant fluid loss, the amount of blood reaching the kidneys can fall. If this becomes severe, the kidneys can suddenly lose their ability to function properly. This is known as acute kidney injury. So when your body is losing significant amounts of fluid, don't ignore it. Replace those fluids appropriately. And when the situation is severe, seek medical attention. Another area that deserves our attention is the use of herbal preparations and unregulated remedies. There is a common belief that because something is natural, it must automatically be safe. That is not necessarily true. Some herbal preparations may contain substances that can injure the kidneys, while others may contain unknown ingredients or contaminants. The risk becomes even greater when people combine different herbal preparations with conventional medications. without knowing how they may interact. And finally, not every kidney disease is caused by lifestyle. There are conditions such as glomerulonephritis, eye nephropathy, lupus nephritis, and polycystic kidney disease, congenital kidney abnormalities, and hereditary kidney diseases that can affect kidney function. These are some of the major causes and conditions that can affect the kidneys.